Eyesight is something we should never take for granted, certainly a key aspect to life. Eye health may be something most of us never really give a lot of thought to, but it's a key factor in our overall well being. Joining us today to talk about eye health is Dr. Olivia Viergutz. She is an optometrist with Visual Effects, partners with FYI Doctors, located in downtown Lethbridge. Welcome to Bridge City News.
Hi, thanks for having me.
It's great to have you here. Now, I did not know this, but I was informed today that January is Glaucoma Awareness Month. So why don't we start off by asking what glaucoma is and how can we know maybe from symptoms that it might be an issue?
You're absolutely right. January is Glaucoma Awareness Month. Glaucoma is an eye condition that causes damage to our optic nerve. And as that progresses, it can result in irreversible vision loss. There's actually different types of glaucoma. The most common one is called primary open angle glaucoma. This one, you might have heard it referred to as the silent thief of sight. And that's because in its early stages, it actually doesn't have any symptoms. What happens is we have a bit of a higher eye pressure, and over time, that pressure can actually cause some mechanical stress on our optic nerve that's at the back of the eye, and that's where the damage can set in. Now, there are some other types of glaucoma that do have symptoms. These can be blurry vision, eye pain or eye redness, nausea and headaches, but these types are a little bit more uncommon.
Wow, that sounds like a pretty serious issue. Now, who is typically at risk for glaucoma?
Yeah, so um, Anyone who has a family history of glaucoma, especially a first line relative such as our parents, there's an increased risk there. As we get older, that risk increases as well. Anyone who's had an injury to the eye, that can increase our risk as well. And having certain cardiovascular conditions, so high or low blood pressure, different heart conditions as well, can be risks as well.
Right, wow. So, is there something that can be done to prevent glaucoma?
So a lot of those variables, unfortunately, are things that we can't control. One of the main things is having your regular eye exams with your optometrist. That way, they can monitor things and pick up on any potential early signs that may then lead to glaucoma in the future.
Well, that's really interesting. And it's great to have the option to have our eyes checked and go to see someone like yourself. So, what kind of treatments are available for glaucoma, and do they have a different level of effectiveness?
So effectiveness may vary individual to individual. Commonly, people will be started on an eye drop to lower the eye pressure. There are other laser procedures that ophthalmology can perform, and the laser procedure, what it actually does is opens up the drainage system of the eye to then lower the eye pressure that way. This procedure can be a little more temporary, and often it can be needed to be repeated, and it's often used in conjunction with the drops. If those things don't work, there are further surgeries that can be done, such as drainage tubes or flaps that also can drain some of the fluid as well.
Well, that's very interesting. So, is this similar to, let's say, maybe something called conjunctivitis?
No, so conjunctivitis is just affecting the tissue, the clear tissue at the front of the eye over top of the white tissue, the sclera. So there's different types of conjunctivitis. It can be a bacterial conjunctivitis, an allergy, or a viral type of conjunctivitis. So that would be a different condition than what we're talking about
Gotcha.
there.
Well, thanks for explaining that. It's good to get the clarification and to have a little bit better understanding. And I suppose one way to have a better understanding of our eyes is to have that eye exam that you were talking about. So, is there an optimal frequency?
Yeah, so a lot of that has to do on our age. The Alberta Association of Optometrists actually recommends we can have our first exam even around 6 to 9 months of age. At least one exam between the ages 2 and 5. And then kids are typically monitored annually. Around the ages 19 to 64, we'll say at least every 2 years. Anyone 65 years and older are actually covered annually by Alberta Healthcare. Of course, this will all differ person to person, and your optometrist may recommend more frequent visits just based on your own personal eye care needs.
Right. Now, you mentioned children just moments ago in that last answer. So, I have been reading some headlines stating that children today, they may be in need of glasses more than previous generations and possibly at an earlier age. Um, have you seen this, and could you tell us why this might be the case?
Yeah, so we definitely are starting to see both of those things. So nearsightedness, or it's also known as myopia, that's when our vision looking at objects close to us are clear and things a bit further away are blurry. What we've been noticing is that now that technology is becoming a much bigger part of our lives, especially even kids as well, whether it's looking at a phone, a tablet, TV screens, rather than playing outdoors, compared to maybe some of the previous generations. We're finding this has a link to increase in developing this nearsightedness. And so trying to limit those activities or breaking up the time we're doing those, that can help slow down either the progression of nearsightedness or from it starting in the first place.
Right. So then, speaking of that, is there things that we can do to help our eyes stay strong and be healthy?
Yeah, absolutely. So, that the biggest one I just mentioned, the screen time for children. Now having outdoor time is good. Of course, when we're outdoors, wearing sunglasses, protecting the eyes from the UV sunlight, that can cause different eye progressions or eye conditions to show up, such as cataracts earlier in life, things like macular degeneration. So that's where sunglasses are very important. Having a healthy diet and lifestyle. So staying active, eating leafy green vegetables, things with lots of vitamins like bell peppers, citrus fruits. Smoking can be a big thing that can cause eye conditions, especially macular degeneration. So, trying to avoid cigarette smoking. So, those are kind of the main things that we can do on a day to day basis to keep our eyes healthy.
So then there's also that inverse of it too of could you give us maybe the top 5 things that cause eyesight to decrease?
Yeah, so I would say definitely those things I listed. So, yeah, so sun protection. So if we're not wearing the sunglasses, having regular eye exams. That way we can detect any of these eye conditions early. No smoking and healthy diet.
So you had mentioned macular degeneration.
Yeah.
That sounds kind of frightening. Can you give us a description of what that is?
Yeah, so the macula of our eye is at the back of the eye. It's the central area of our retina. And over time, we can have notice some damage to that area of the eye. And that things that can cause that are the family history, UV sunlight, smoking, not getting enough antioxidants to protect that part of the eye. And so the trouble with that condition is it's affecting that central vision. So our what the vision rely on the most to see details and that type of thing. So it can, and as it progresses, become definitely a visually devastating condition. So that's definitely one we want to try to catch early and monitor.
Yeah, really sounds very important to have maintenance, not just for other parts of the body, but your eyes. They're just such a critical component of our well-being. So it's really interesting to chat about these things with you because we may not always think about that. And one of the things, of course, I don't wear glasses or contact lenses, so I don't really think in terms of do you have any advice for those who wear contact lenses and maybe related infections? But what's your advice there?
Yeah, so the biggest advice I could probably give there is to follow the recommendations and guidelines that your prescribing optometrist has provided you. So, not following these guidelines can lead to increased risk of infection, not getting enough oxygen to the surface of the eye, and that can lead to new blood vessel growth. And both of those things can lead to permanent vision loss as they progress. So, those common guidelines are going to be not sleeping in your contact lenses, having proper hygiene and cleaning the lenses, and then also not extending the length that you're using your contacts for. So if it's a daily lens, not wearing it more than that 1 day, and then monthly lenses, once that 30 days of using that lenses is up, making sure we're switching to a new fresh lens.
Wow, those sound like really important things to keep in mind. I wanted to ask you about dry eyes. And I don't know if that's a regional thing, but it's something that I hear a lot about here in southern Alberta. What do you have to tell us about dry eyes?
Yeah, so definitely where we live, we'll see a higher amount of dry eye just because of our environment. It's very dry climate, very windy. So those types of things will definitely play a factor into it. Um, Again, there's lots of things we can do for dry eye. That's been something that there's been tons of research going into. So of course, there's the things we can do at home, such as eye drops and warm compresses, omega-3 supplements. But we actually have a lot of in-office treatments nowadays that our optometrists can perform if those things aren't helping our symptoms enough. So we're lucky to see that progression and that development with the research to have more things available to treat it.
Right. And so you mentioned the word research, which brings me to my next question about new developments with contact lenses that has come from some different research. Now, apparently, this new development for contact lenses can actually help stop the progression of nearsightedness in children. Could you talk a little bit about that?
Yeah, so that's definitely correct. We have lots of options nowadays for what we call myopia control or controlling that nearsightedness progression. So the contact lens specifically, so how they differ between just the normal contact we think about is they include some treatment zones within the lens, and that's been shown to slow that progression and that lengthening of our eyeball, as long as we're wearing the contacts for the recommended period of time.
Well, that's interesting. Now, this one, it still has to do with eyes, a little off topic, but some of my friends that work in the trades, they have the choice of safety squints or safety glasses. Can you talk a little bit about even people with hobbies or working in the shop about uh, how to protect our eyes with safety glasses and other things like that?
Yeah, so safety glasses are really important, especially when we're dealing with work environments like that. We often see people coming in that deal with metal work and they're getting little foreign bodies, metal in the eyes, and depending where that metal lands, it can leave scars and that type of thing. So the more that we can protect that things from getting into our eyes like that, the healthier they will be. Protecting them from trauma as well. If we're in a workplace where those incidents can happen as
Gotcha.
well.
Yeah, the safety glasses are always better than safety squints, that's for sure. So I wanted to ask you about cataracts. And I'm sure that technology has come a long way over the last 30 or 40 years. But I wanted to ask you, can you tell us the cause and maybe the age that cataracts tend to start at?
Yeah, so cataracts happen when the lens inside our eye starts to become clouded. Most commonly, this occurs with age. So that'd be the most common cause of the cataracts. UV sunlight is something that can cause cataracts to increase. Having certain systemic conditions, so things like diabetes can cause those to develop. There are some medications that can cause cataracts to develop earlier. And there actually are some congenital cataracts. That's not as common, but some kids are actually born with the cataracts.
Wow. And so do sunglasses, like actually good, like polarized lenses, do those actually help from maybe preventing the formulation of cataracts?
Yeah, so anytime we can keep those sunglasses on that have that 100% UV protection, it's going to filter that light out before it gets to the lens in our eye. And then by doing that, yeah, it can slow down that development or progression of
Interesting.
cataracts.
I've never thought of that being a benefit of some good polarized lenses in sunglasses. Now, a lot of people go for cataract surgery. How much of a process is this, and is there a large success rate to these surgeries?
Yeah, so nowadays, cataract surgery is very successful surgery to have done. It is a day surgery, so typically one eye is done at a time, and it usually only lasts about 10 to 15 minutes per eye. And so, yeah, absolutely, that success rate is much higher now. There's different technologies. Our surgeons are very successful and good at what they do. Yeah.
Oh, that's great. Now, the one thing we haven't talked about is laser eye surgery. That's become quite popular. What can you tell us about that? Maybe how long it lasts? Is it a forever cure?
So, the kind of length of it lasting, that can vary person to person. We're finding a lot more success nowadays with laser eye surgery, and a lot of that has to do with the preoperative assessments they put each individual through. That way, they can first determine if you're a good candidate for it, which has shown the success rates to increase. So typically when someone has laser eye surgery, it's correcting for their distance vision. So there's a very high percentage of people getting to 20/20 vision once having that surgery done. What they might notice later in life, or typically will notice, is what we call presbyopia. And that's where everyone starts to lose the natural focusing ability of her eye. And so at some point, they may need reading glasses once that starts to set in.
Gotcha. Well, that's all the time we have for today. Dr. Viergutz, thank you so much for being with us today.
Thank you so much for asking me to be here.
Dr. Olivia Viergutz is an optometrist with visual effects, partners with FYI Doctors here in Lethbridge.